So in Quebec, the goal of the influenza vaccination campaign every year is really to protect those that are at highest risk of complications and death from influenza. So it's really a matter of targeting those various groups across the province. It used to happen, with big mass vaccination campaigns where they would either rent a hall or a mall and then would invite people who are falling in those categories to come and get vaccinated. Of course, this year, because of COVID, all those close encounters are banned. And so there needs to be a better way to vaccinate people. And so this year, the vaccination has been delocalized to where either patients are seen, to pharmacies, so smaller venues where people can either take an appointment beforehand or just show up, but where there is less risk of having, big treatments.
Who exactly is targeted in this campaign? And especially because Sainte-Justine, you're mostly treating the kids, right? So who is your target in this?
So for us at Sainte-Justine, what we've decided to do was to offer vaccination for children with high risk conditions and their household contacts. So if, let's say, for patients who are followed here. So this year, what happened is that every clinic came out with a list of their patients that they follow regularly and said this patient has a condition that makes him high risk of influenza, based on the criteria that are in the Protocole sur l'immunisation du Québec. And so a letter was sent to those families to say, starting on November 16th, there will be walk-in clinic for influenza. So if you come either for your appointment or you just want to come by and get your child and your family vaccinated, you can just come and get it. And so that started on Monday. It's trickling in slowly. I think we had 80 on Monday, and I don't know the other days how many there were. But so when people are coming for their appointment, they can get their vaccine. The idea was that thinking that the CLSCs were likely going to be overwhelmed because some of those people needed to take care of COVID issues, we said, we're going to offer at least that possibility to our own clientele.
So is this really the first of its kind for Sainte-Justine? Like this is not a usual vaccine campaign.
So we did it last year at a smaller scale, where people could just, if they were coming to their appointment, they could just show up to the clinic. So it's a second year, but we've expanded it so that there's more space and more availability. But it's a second year in a row. It used to be done at the Montreal Children's Hospital also when I was there, and so it's a model that exists and that works. I mean, it's really. I think that a lot of people are not going to get vaccinated just because it is complicated to get it. And that's why I think pharmacies work so well. It's because they have extended hours. You can stick an appointment and go. And this is also the same. You come to the hospital for something else, might as well just get it on your way out or your way in so that you don't need to make a second appointment.
Absolutely. Tell me a little bit about why it is so important this year, especially due to COVID, to get a influenza vaccine.
Well, as much as children are not really sick with COVID as of now, what we were wishing was that for those children at higher risk of influenza, is that at least if you protect them against a fever and flu, they won't have to come and be seen at the hospital to say, is this COVID, is it influenza? You will decrease their need for emergency care and hopefully for hospitalization. So that's why we're not offering the influenza vaccine to every child, but really targeting it to those with high risk conditions.
What exactly are, I guess, the conditions, the underlying conditions that makes a child high risk?
There's a whole list of them, but I mean, I can read them to you, but it's going to take forever. But basically, if you have a chronic heart condition, lung condition, you have various liver problems. Of course, if you're immunosuppressed, if you're diabetic, so it's people who have other health conditions and asthma, for instance, severe asthma. They would need to be vaccinated. But the whole list is available on the Minister of Health site and in the Protocole sur l'immunisation du Québec.
Perfect. Just tell me lastly, how dangerous could influenza be for children with these underlying conditions? As we saw last year with the young girl, otherwise healthy, just to bring that up, she ended up passing away due to a number of liver failures, as we saw. So, and her mother didn't really know of any conditions. So what do we know about this? How rare is it?
So to have a healthy child die of influenza is very rare, but it still happens. Would it have been preventable? Maybe, but what we know is that children with underlying medical conditions are more at risk of being admitted and of dying from influenza than the general healthy children population. So that's why we're targeting them more than the healthy kids.
Is there anything else I should know about flu season in general? I read that it hasn't yet started. Do we know anything about that?
Well, usually the flu season starts a little bit later, usually around Christmas time. And usually all those gatherings at Christmas increases the transmission of influenza. But what we've seen in other countries in the southern hemisphere, though, is that because of of physical distancing and mask wearing, the flu season was actually the lowest they've ever seen. So whether or not we're going to see the same thing, maybe, hopefully. And so hopefully we, because of everything else we're doing appropriately, that will also prevent influenza.
Fantastic. And so, with the idea of, possibly less gatherings around Christmas time, do you expect there to be a sort of uptick or a start to the season because some people may gather, or because of the protocols and everything you're doing in place, maybe it'll be a extremely low season?
So hopefully it'll be a low season, but yes, when people start gathering, if somebody in there has influenza and you gather indoors with no mask, as we usually do, then the risk of transmission is there. We'll have to see, based on, as you said, the probably smaller gatherings, if we are going to have a smaller influenza season. I mean, it's hard to predict. One would think that the influenza season would be smaller this year, but you never know.
Thank you so much for your time. I really appreciate it.